coronavirus and the pandemic, it just has exacerbated the situation. Having children not in school contributed to an increase in teen and child pregnancies. Now, with me in studio to help us dig into this conversation is Kate Maina-Volley, Plan International Country Director, and she is, of course, going to help us paint a picture of the situation. Also, we have Davis Okombo, child rights activist, joining us live from Kisumu, our studio in Kisumu, as well as Vivian Mwende, legal counsel, FIDA Kenya. Thank you so much, ladies and gent, for joining us this morning. And I'll start off with Kate Maina-Volley. Could you paint a picture of us of the situation in the country today as far as child pregnancies are concerned?
Thank you very much, and good morning. Always a pleasure to be here.
Good morning.
This really is a national discussion, so I'm always, open to any opportunity to speak about this. I'm always looking at the data because the data tells a story.
Yeah.
And there's some shocking statistics, and I know we all know about this, but it's important to always remind ourselves. 1 in every 5 teenage girls between the age of 15 to 19 is either pregnant or has had a first child, pregnant with their first child or has given birth. And this is a number that has been there for 10 years.
Wow.
Adolescent girls account for 14% of all our births in Kenya. The MOH, Ministry of Health Information System, tells us over 320,000 girls got pregnant last year, 2020, of which 100,000 pregnancies led to early or forced marriage. So we're talking here child marriage. 98% of girls who have ever been pregnant are out of school now. 63% of those pregnancies among adolescents in Kenya were unintended. And out of those that were unintended, a third of them ended in abortion. Some of them, 50%, with severe abortion among those adolescent girls. And the data goes on and on and on. And almost 1 in every 4 girls in Kenya is married before the age of 14.
Wow.
So there's some powerful data there around the state of the nation when it comes to our young people and when it comes to adolescent girls. And I always say the data is important because it helps with planning, but 1 teenage pregnancy is 1 pregnancy too much.
Yes.
And so this conversation has to be sustained.
Yes, it does have to be sustained. And I like that you pointed out that one thing leads to the other. You have a teenage pregnancy that leads to going out of school. Now this girl is not attending school as usual. And of course, there's an extra mouth to feed. And perhaps the solution some of the parents might feel is then to ship her off to her boyfriend or husband or whoever for early marriage. And of course, this then means that they cannot be as productive as they would have been had they continued on to stay in school and, become whoever they dreamt of becoming. And of course, that would feed into our society and ensure that they are productive and aiding in the economy and supporting themselves and their family. Davis Okombo is a child rights activist joining us from Kisumu. Would you tell us your view of the fact that many of these early marriages go against the child's rights, and at the same time, many of those relationships are not healthy relationships. They turn out to be quite abusive.
Thank you very much indeed, and I'm privileged to be part of this national discussion. I would wish to point out that Kenya is a signatory to the United Nations Convention on the Rights of the Child, and therefore Kenya has an international obligation to ensure that child protection is achieved right here in Kenya. Now, we have the Children Act of 2008, which guarantees the rights and welfare of the child. And both the UN Convention on the Rights of the Child as well as the Constitution of Kenya 2010 and also the Children Act of 2008 define a child as any person below the age of 18. And therefore, where such children become pregnant or are sexually abused, this is a gross violation of the rights of the children, and we have to condemn it in the strongest terms possible. I also wish to refer you to the national survey that was conducted by the government on violence against children here in Kenya in 2019, and the report paints a very grim picture of violence against children, which involves sexual violence. And I agree with my fellow panelists that the situation of children who are forced into sexual violence is extremely sad, and we need to act very fast to stem the increasing numbers.
Important to note that those rights, and also it's important to note that those rights are upheld by the law. But then these are children we're talking about, and therefore someone needs to stand in the gap to ensure that they get justice when their rights are gone, are taken away from them. And to weigh in on that matter is Vivian Mwende, Law Counsel, FIDA Kenya. What is FIDA doing to ensure that these numbers are tackled? We had earlier on Kate telling us that one pregnancy is one too many, and at the same time there's justice needed in many of these situations. What is FIDA doing to ensure that young children, teenagers, however you may put it, actually get their rights fulfilled? And when those rights are taken away, the law can step in as a protector.
Right, thank you very much, and good morning. Indeed, this is an issue that has really come at a time, it has come to light rather, right now in a high number, but allow me to say that it's an issue that has come out for a very long time. If you look at the UNICEF report that was done way in 2000, they stated that 50% of the teen pregnancies that we are having in Kenya was too high at that time. So what COVID-19 came to do was just to bring out to light something that has been happening, an issue, an SGBV and a violence that has been happening. And what FIDA has done in this period of COVID-19 is to bring out the statistics that we've been having, together with bringing out teen pregnancies to light and documenting such issues, coming up with a toll-free number, and also bringing out counselors who can support these girls who have undergone such violence. Because we know most of these teen pregnancies come out from defilement, because actually they're not meant to be engaging with sex, engaging in sex under the age of 18 years. So most of them is defilement. So we are having so many cases that were coming out to light. We are bringing out so many issues of incest, and what FIDA was doing was taking up these matters, watching brief in these cases, teaching these girls, other girls who have not gotten pregnant yet, teaching them about the sexual reproductive health, which is their right. And as well as speaking to the government, starting from the chiefs at the lower level, telling them that every girl has the right to, even if they're pregnant, they have a right to learn and going back to school, as is the what the Constitution says, that do not discriminate under Article 27, even if the girl is pregnant. So what FIDA has done, one, we came up with the toll-free 9 that was able, most of the teen pregnant girls were able to call in and just say that they have undergone a certain issue, they're being molested back at home, and speaking up with other shelter houses just to ensure that they get shelter, talking to counselors so that they can get that help in terms of psychosocial support. Indeed, it has been an issue that has really disturbed this country. It is a time, I'm glad His Excellency, the President, spoke about it last year. Was it a moment that the chiefs were put up to speed so that they take action in regards to it? Yes, but I feel like it's a matter that could have been handled way before. The state is mandated under Article 55 to ensure there's that positive affirmative action, that every girl in this country has the role and has the right to be able to get education in Kenya, despite them being pregnant.
Absolutely. And Kate, you did speak about the situation. You gave us very good data that paints a very concerning picture. For the past 10 years, the numbers are worrying. And as she has said, the coronavirus just brought up, or rather exposed what was underneath, the bit of the iceberg that was underneath the water. Now, when you look at those numbers and you look at what she said about the efforts FIDA is making, is enough being done to ensure that girls come to a point like the girl in the video that we saw earlier on, whereby she gets back to school and can actually pursue her dreams?
Yeah, no, it's a good question. You know, Frida mentioned the role of government as the duty bearer. And yes, we do need to continually hold government accountable to delivering on the conventions they have signed up for. It is worth noting that the National Council for Population and Development launched last year a campaign, Let's Act to End Teenage Pregnancy. And so, she also mentioned some of the efforts by our own president, call to action. This campaign is an opportunity for us collectively to support a sustained campaign to end teenage pregnancies. But in that, we really must walk the talk. You know, we are known for very good policies, very good intentions. I think we have an opportunity, all of us, to come together in partnership to really support this national campaign to end teenage pregnancies. It requires a multifaceted, multi-sectoral, multi-level approach to address so many issues, including the drivers of teenage pregnancy. The data, and the profile of data and the data sets really speaks to so many things around what are these drivers that are driving teenage pregnancies, and how is our national response responsive of those drivers. Because the solutions must be contextualized as well.
Absolutely.
And it's also important, one of the things we're very proud about as Plan, we launched our new 5-year strategy last week. And our strategy is very deliberate about keeping a spotlight on this issue on teenage pregnancies. We have committed in the next 5 years to support efforts to end teenage pregnancies and all forms of gender-based violence.
Absolutely.
And so it's a call to action for all of us, pulling together multifaceted, multi-comprehensive, and understanding the drivers of these teenage pregnancies so that our response is responsive.
Absolutely. And Davis, I'd like you to come in and talk to us about how education plays a key role in this whole conversation, because as we said earlier on, the coronavirus, because children are not going to school as usual, it actually led to an increase, because it means that education and the setup of certain institutions actually cushion the girl child from certain issues, as far away from the fact that if they go through the education process, then they'll be able to be productive members of society. Speak to us about that, right? And of course, with key focus on the fact that some of these girls never get to go back to school after they get pregnant. What can be done?
Thank you very much indeed. Article 53 of the Constitution guarantees the right to education for all children in Kenya. And research does indicate that keeping children in school is one of the evidence-based strategy of ensuring that teenage pregnancy is reduced. And I agree with you that the lockdown measures that were imposed as a result of the pandemic in last year significantly led to an increase in the numbers that we are talking about right now. And allow me to state very categorically that we have the Sustainable Development Goals of the United Nations, of which Kenya has signed. And Goal 3, and particularly 3.7, makes calls for the universal access to reproductive sexual health and rights and information. And remember, in 2019, there was the International Conference on Population and Development, which was held here in Nairobi in Kenya. And there was a call for a plan of action to ensure that we have zero unmet family planning needs and information and so on. Therefore, there is an urgent need for the people of Kenya to understand and accept that it is time that our teenage girls and boys have access to reproductive health. Yes. We know very well that our girls and our boys are also sexually active, and this is a discussion that we are able to explore further. But are we able to give them information so that they can make choices? Because remember, according to the World Health Organization, a teenager or teenage pregnancy is defined as any pregnancy of a person between the age of 10 to 20 years. So the question that we ask is, are our girls able to access reproductive health? if a child wants to have birth control, perhaps at the age of 17 years, do we have systems in place that allow them to access such rights? Right. These are the discussions that we need to address as the people of Kenya.
Absolutely. Now, Kate, before I get to our legal counsel from FIDA, Vivian, I'd like you to talk about that part of reproductive health and the right to access to reproductive health for young girls. There are certain cultural norms and ideologies in our society that actually stand in the way of that. And you mentioned earlier on, many of these pregnancies wind up in abortion clinics, and obviously that's not ideal because you know the complications that come with that. Speak to us about the access and availability of reproductive health services.
Yeah, this is a conversation that we know we've had this conversation many times as a nation. We do have the adolescent health policy that speaks to intentions to provide these services to our youth.
Yes.
I think we really need to look at to what extent this is comprehensive, and I would argue this is responsive. You know, our colleague, our panelist has said here that, you know, we can't sweep these things under the carpet.
Yeah.
Our girls and boys are actively having sex, and we need to ensure that we are responding to their needs, and that any sex education or comprehensive sexual health rights education is responsive to their needs at that time, not to the needs that policymakers or adults perceive, but responsive to their individual needs. And so we need to make sure that there is comprehensive sexuality education, they're getting the right information, there are safe spaces for them to access adolescent-friendly health services,
right.
and that the commodities are there, and that there is no stigma associated with that. And these are conversations we've had. The policy environment is there.
Yes.
I know there's been a bill that's still in Parliament that hasn't been passed. We need to go back to that campaign, let's act to end teenage pregnancy. We need to unpack what those actions need to be, because the policies are there. So why do we still have these challenges regarding access to SRHR or uptake to the services? Is the information available? Do both men and do both girls and boys feel well equipped with information to be able to access those services? Are they adolescent friendly? So there's a whole myriad of issues here, but are they responsive as well? So even as we act as a nation to end teenage pregnancies, the voices of young people are so important for us to understand where there is, why isn't there uptake to this SRHR services? And I would also add the role of parents,
yes,
and the role of community caregiver, community gatekeepers, because we are a nation that's governed by social norms, and social norms can define my behavior and the things I choose to take or not to take. And so we also need to look at our social norms and to what extent they enable young people to access adolescent sexual reproductive health.
Absolutely. And Ms. Mwende, could you speak to us about the challenges that perhaps you face in implementing the law and perhaps supporting young girls? Because as we have this conversation, there is the glaring fact that most of these girls are minors, and therefore they need to be protected. What stands in the way of striking the fear of God, so to speak, in some of these perpetrators? Because sometimes that is what is needed before someone goes for a young girl. They need to be aware that the law will be watching out for them, and the long arm of the law shall catch up with them after.
Indeed, and if you look at the Sexual Offences Act, it really brought out some of the offences that has gone through during this period of COVID-19. And allow me to state this. The issue of repugnant to justice and morality, which the law says that cultural norms, which is one of the factors that really affects the implementation of the law.
Yes.
If we are to unpack justice, and we say that if you impact the cultural norms against the implementation of the law, is it right, is it just that this child is kept away from the education to learn about sexual and reproductive health, because we have to be very sincere with ourselves. What we have seen before 2020 and going behind, we have seen most of the things that come up, even our television stations, our radio, issues that tend to relate to sex is normally treated with a lot of shyness, and normally we kick out the girls from the sitting room, we kick away our relatives, we say, usiangalie hiyo, or this is not for your age, you're not supposed to see this. But what we discovered as FIDA Kenya last year, when we did 2 trainings, both in Murang'a and Machakos, we noticed that these girls are aware. We went there thinking and feeling we know best. But we went there, we were shocked in the manner in which these girls are aware about their sexual and reproductive health. They kept exchanging a lot of ideas. They knew more. We really need, as a nation, just as we have discussed earlier in this conversation, that we need to know that first they know. Let's treat them up as people that they know. So what we are telling them is this. What is the parameter that is there in the law? Now we need to tell them about the law and the process in which they are supposed to report. There are a lot of offenses under the Sexual Offences Act. I mean, it's a conversation that this country has had, that so many offenders and so many victims who have been under the Sexual Offences Act are too high. Most of the men in prisons are saying it's because of sexual offenses. But is it enough? It still keeps continuing. So a lot of education, a lot of multi-agency. How about we come up with a campaign, Rudi Shule kwa msichana, for example, and it is going to be a multi-agency cooperation, not just Plan International, not just FIDA Kenya, but it is the role of everybody, where we are going to have the parents sitting there, we'll have the pastors, we are going to have the imams, we are going to have everybody sitting there and having this conversation, as if not is a shy conversation, but a conversation that it is time for us to discuss about it.
Absolutely. Now, Davis, could you speak to us about the juxtaposition of cultural norms and perhaps some of the ills that you witnessed? Let's take the context of Kisumu. I know Plan International is centered in Nairobi and Kisumu area, if I'm not wrong. Could you speak to us about the cultural norms that need to be done away with and why the community needs to be coming in, even religious leaders, as Ms. Mwende has put it, to ensure that this is put to an end?
Well, thank you very much indeed. I do agree with the rest of my colleagues that culture, and especially retrogressive culture, hampers the implementation of the rights of the child, and we need to speak about it very seriously. In the context of culture, there are practices that take place in the context of human rights violations, and this includes early child marriages, which occur in many parts of this country. And we have to agree as the people of Kenya that cultures that do not work in the best interest of the child, we have to do away with them. We have certain cultures also, like female genital mutilation, which is a form of violation of girls and women's rights. And I think it's high time we have to agree. We have to say that this is illegal. We have to stop it. Again, in Kisumu in particular, there have been a lot of studies that have been conducted on child prostitution and so on, which again is associated with increasing levels of poverty. Therefore, we need to work together through national and county budgeting processes to ensure that social protection systems and flaws are established in the country so that we leave no child behind as we work towards achieving the development goals.
Right. Now, you've mentioned poverty. Kate, poverty is never far away when you're dealing with certain issues, and even when it comes to exposure to information, the more affluent in society have their kids more informed, I would hope. That's the assumption, as opposed to the children who are not very well, from very well-off families. So poverty does have a direct impact in some of these things. things. Children are taken advantage of because they're promised pads and things like that. Before you know it, they're pregnant. So could you speak to us about that? And as we conclude, give us your closing remarks on what you would love to see happen in this country in order to tackle this child pregnancies once and for all.
Yeah, no, thank you. I think we often underestimate the role of poverty.
Yes.
In driving some of these issues, and poverty is a key driver to teenage pregnancies. We deliver a lot of programs, not just in Nairobi and Nyanza. We also have programs in Central. We have programs in the coast, and we have seen the impact of poverty at the household level and on the children, both girls and boys, that we seek to serve. And poverty manifests itself in so many ways. And when we speak to girls and we engage with the communities, we are seeing a lot of what we call transactional sex. We've all heard last year, sex for pads, sex poverty. These are terms that we're bandying around that really remind us that poverty is an issue that needs to be dealt with.
Yeah.
Because it is what is catapulting our adolescents to behaviors, because they want to be able to buy that sanitary towel.
Yeah.
And sometimes their caregivers, their parents, with all the best intention, they're struggling to put food on the table. And so, this multifaceted response being spearheaded by NCPD really does require us to look at that as well. The social aspects, the social norms, implementation of our policies, some of the gaps in our policies. We have the re-entry policy. We need to talk about inclusion. We need to talk about the stigma that prevents people from really taking up, going back to school after they've gotten pregnant. But we also need to look at the poverty and how we are going to build resilience and generate economic activity in these areas so that households can put food on the table and caregivers and parents can buy that sanitary towel for their child.
Absolutely.
Yeah.
Wande, what is your take on that? The role of poverty and, of course, the legal frameworks that are available. What more can be done to ensure we are tackling child pregnancies once and for all?
Earlier in this show, I mentioned about Article 55 of the Constitution of Kenya that talks specifically about positive discrimination. If we are to speak further about it, what we are saying is that the state has a role, as mandated by the Constitution, to get funds and grants from donors in itself, as well as taxpayers' money, to be able to provide these sanitary towels for the girls. Just saying, for example, these funds purely, it's just going to create a funding for sanitary pads for the girls that we have in schools. That is what we call positive discrimination. Secondly, something that we noticed during the implementation of the training of sexual and reproductive health rights last year during COVID-19, we noticed that these girls are not confident to approach our police stations. So what are we saying? If there is an offense of defilement that has happened, which has brought about teen pregnancies, which is really the high rate that we are having, that it is defilement or incest. So they need to feel confident that when they go to these police persons, who is at the gender desk, they are able to be listened to.
Right.
So the manner in which we take these girls to trips, to orphanages, we take them to trips, school trips, for them to learn, how about we walk them, let's go to the next police station. This is the process. When you approach this gender desk, you're going to be greeted nicely. You're not going to be asked intimidating questions. For example, what were you doing there at that time? In a manner in which the girl will feel scared to be able to say or to mention the perpetrator. So let us make the reporting as well very normal.
Yes.
Let us make it very easy and friendly.
Absolutely.
Thirdly, we have the role as interagencies as well as the implementers of the law to make law easy. That's the manner in which we have trained them, in which we've made biology understandable to them, in which they can really understand upon the first or the second reading. We can make the law easy. We come up with pamphlets. We tell them that this is the process. We draw pictures in which it will draw in their attention. We know our youth love and something that will draw their attention.
Right.
So if if the interagencies and if as a state, even the media, allow me to say, if we put pictures that shows the process of reporting, that shows this is the laws that govern sexual harassment or sexual offences or defilements in Kenya, they're going to be drawn to it.
Right.
It is high time for them to be drawn into the law and the process. Thank you.
Unfortunately, we have run out of time. We had in studio Kate Maina Volley, who is the Plan International Country Director, joining us, who was joining us here in studio. She, of course, has given us insight on the work that is being done to ensure that we are tackling teen pregnancies. At the same time, we had Davis Okombo, children rights activist, joining us from Kisumu live, and Vivian Mwende, legal counsel, feeder from our I&M studio. Thank you so much, ladies and gentlemen, for joining us this morning and shedding more light on the issue of child pregnancies. Hopefully that can be tackled one way or the other once and for all. And that brings us to a close of Morning Express. Thank you so much for tuning in all the way from 6 to now. See you tomorrow, same place, same time. Have yourself a fantastic day ahead. My name is Trix Ingado.